Senator Lyons.
Mr Acting Deputy President, and I rise today to really question and to speak against the government's decision to abolish Health Workforce Australia. This decision is a clear demonstration of the Abbott government's lack of vision for Australia, its complete failure to plan for the future, its failure to take responsibility for the health of Australians, and its ideological hatred of anything that strengthens our universal healthcare system. Health Workforce Australia was our vision, Labor's vision, to establish a national approach to the planning and training of Australia's health workforce. Labor, unlike the Abbott government, wanted to ensure that we planned today for Australia's health needs of the future. Labor inherited from the last Liberal National Government a piecemeal approach to health workforce planning, a system that responded badly in an ad hoc way to peaks and troughs in the level of supply. And under this, if the abolition of the Health Workforce Australia goes through, health workforce planning will fall back on states and territories. And I'd like to illustrate just how ill-equipped my state under the Barnett Liberal government is to deal with the issue of health workforce planning. And I'm sure that the government senators from Western Australia today have seen the headlines in the West Australian newspaper. The Barnett government 12 months ago lost our AAA credit rating in a state where the money flows from mining dollars, a state rich in resources. We saw the Barnett Liberal government just disappear through its absolute poor management, our AAA credit rating. And today, the West Australian is reporting once again that the Barnett government is now down to AA1. What a disgrace! What squandering, what mismanagement by a Liberal government in the state of Western Australia, where our prospects and our health should lead the nation, not lag behind. And remember what our Prime Minister, Mr Abbott, said of Mr Barnett. Remember when the Prime Minister said he wanted to be a leader like Mr Barnett. Well, he's going down the same path. He's going down exactly the same path. No vision, no plan, just a plan to abolish the Health Workforce Australia, a body set up specifically to look at the health needs of our future. But let's just continue along the West Australian theme for a moment. If they are to take up the planning of health, the planning of our workforce, their take on health in Western Australia is nothing short of a cot case, an absolute disgrace. The latest report on our brand new, fully costed under Labor, our brand new hospital, Fiona Stanley, which should be the showcase of the nation, and this report was published by the Auditor-General in June. It criticised the Barnett Liberal government for wasting taxpayers' money, and failing to deliver top-class, world-renowned information, communication and technology. You think in a brand new hospital with proper planning by the state government we could get that right. But no, yet another bungle by the Barnett government over Fiona Stanley Hospital. So the Auditor-General's report, the June report, reveals that the Barnett government, as we know, as WA taxpayers know, is making a mess of the Fiona Stanley Hospital, and this time with critical information, communication and technology, something that is needed to create a modern, world-class functioning hospital. And that alone, that one bungle, and there's been countless bungles at Fiona Stanley Hospital, has cost Western Australians $370 million. $370 million just gone down the drain by a government who clearly has no idea how to run a health system, let alone plan for the future needs of our health workforce. The Auditor-General went on to say that the project was poorly planned, managed and monitored. Remember, this is by the Barnett government, whose leader, the Prime Minister of the country, said he wanted to copy. Well, he is copying to go ahead and abolish Health Workforce Australia. The woes with Fiona Stanley don't stop there. The hospital's finished. It's complete. It's ready for patients. Well, it would be ready if it hadn't been bungled by the Barnett government. And when was the hospital completed? In December 2013, almost 12 months ago. It's going to be old by the time it gets opened. 12 months ago, almost, that hospital was completed, ready to go. But when will it get patients? Well, there's delay after delay after delay, and we're told now sometime in 2015. What a disgrace! And imagine how much that's costing the taxpayers of Western Australia. And this is where the Abbott government thinks health workforce planning should sit, back with the states. And not only is Fiona Stanley ready to go, but actually it can't go. And why can't it go? Because there are workforce shortages in Western Australia. So we've already seen the Barnett government completely fail to plan for the workforce that's needed at Fiona Stanley. Yet the Abbott government, the Prime Minister, who wants to model himself on the bungled Barnett government in Western Australia, believes somehow that the states and the territories are better placed to manage health workforce planning. Well, nobody in their right mind could agree that the Barnett government can plan anything in health except a massive cost to taxpayers. They can certainly plan that. But they can't plan workforce issues. And the Barnett bungling doesn't just stop at Fiona Stanley Hospital. It failed to deliver women's reproductive services and family planning to the new Midland Hospital. This issue, the lack of women's reproductive technology and family planning, was repeatedly raised by the local community over and over again. It's been a major issue in the Midland area for at least the past 3 years and possibly longer. Yet earlier this year, can you believe it, the Barnett government tries to hoodwink Western Australians by saying, oh, actually, we weren't aware that women's reproductive technology and family planning services weren't going to be available at the new Midland Hospital. I mean, how could they not have been aware? This just shows that they are absolutely incapable of planning health and planning health workforce in Western Australia. But nevertheless, at this point, no reproductive or family planning services are going to be undertaken at the Eastern Suburbs Hospital, the new Midland campus, because the government simply ignored it, thought it would go away and has no capacity to plan. So how can we trust, how can Western Australians trust that the Barnett government will be able to develop long-term workforce planning? It clearly can't even manage the services it's currently accountable for. And that's not the Labor opposition saying that, that's the Auditor-General saying that, poorly managed. But Health Workforce Australia's own record shows the current medical training system is inefficient and it's uneven in its distribution of the medical workforce. And we all know this, and we know this particularly affects rural and regional communities. We also know that chronic diseases are on the rise in Australia, and we know that chronic diseases are the leading cause of death and disability in Australia. None of this is secret. It is obvious. We've got an ageing population, we've got chronic diseases occurring, and we do have workforce shortages, and they are much more acute in rural and regional communities. And we know with chronic diseases that they are associated with a high use of healthcare services, and we know that that puts pressure on our healthcare system in Australia. And we also know that there are cost pressures around chronic diseases. And Australia's ageing population, together with chronic diseases, will lead to greater use of health services, services which require a skilled clinical workforce and solid evidence-based workforce planning, not the sort of mismanagement we've seen in Western Australia by the Barnett government. And work's already underway by Health Workforce Australia. It's already produced Australia's first national long-term projection for doctors, nurses and midwives, with its publication of Health Workforce 2025, Doctors, Nurses and Midwives. And why would we want to throw that out? Why would we want to say we don't want to focus on health workforce planning anymore? We're just going to ignore that and somehow imagine that the Department of Health, with all of its pressures, is going to be able to dedicate particular resources to focus on this vital issue. This report, done by Health Workforce Australia, is the first ever national report, and it identifies Australia's long-term health workforce needs. And health workforce planning is complex. It's not simple, and it can't be left to ill-equipped states and territories, and it certainly can't be left to the Barnett government, who in Western Australia can't manage to be financially responsible with the downgrading of its credit rating today. It certainly can't be left to that. But it does involve coordinating states and territories. And we've seen by the Western Australian examples that states just cannot get this right. They just can't get it right, and it should not be left to them. Health workforce planning needs a focus, and Health Workforce Australia provided that focus, and that focus will be lost in the Department of Health. The abolition of a specific focus through Health Workforce Australia demonstrates once again that the Abbott government has no commitment to health, no plan for Australia's future health needs. It either doesn't care or it expects the issue of workforce planning to happen elsewhere. Another unfunded throwback to the states and territories. What a shambles! What a shambles! And where are the Nationals on this issue? Nowhere to be seen. Supporting the Liberals because the Nationals are interested in power, not people. There's already a shortage, a well-known, well-documented shortage of doctors and nurses in rural areas. What's their plan? They have no plan. They've deserted the bush and left future workforce needs to chance. Just roll the dice, let's see what the numbers are, and maybe the states and territories will provide the much-needed long-term planning. So what will happen? They'll continue to rely, the Abbott government, on recruiting our health workforce.
Thank you, Senator Lyons.
Thank you.